So we begin today with a story about a program in North Carolina that helps low-income seniors understand and get access to proper nutrition. The goal of the program is to achieve behavioral change by educating them about the overall health benefits of proper nutrition. In the program, participants engage in group interactions, skill-building exercises, taste testing, as well as learning about better eating habits. Let's see how the program works.
Good morning.
Good morning.
I'm glad to see so many of you this morning.
5 days a week, these older adults in the Southern Pines of North Carolina come together at this senior center for a hot meal. But they're here for more than just nutrition.
We're going to be talking about pills, potions, and herbals.
They've come to take part in a statewide program called Partners in Wellness. It's a collaborative project between the North Carolina Cooperative Extension Service and the state's Department of Health and Human Services Division of Aging.
Well, when we take supplements or prescriptions or whatever, we need to know why we're taking them.
In just 5 short classes, these seniors learn about dietary supplements and how to increase their vitamin use safely.
Older adults have special needs, and one of them being calcium for their bones and for their bone density. And we know that when they take their calcium, they also need to have vitamin D.
If you're taking over-the-counter drugs, herbals, botanicals, you need to let someone know because they right away can tell you if there will be a drug interaction.
But is the program working? Researchers at North Carolina State University decided to find out.
We did a study, and we showed that the people that do go through Partners in Wellness in this particular module are increasing their usage of 1 a day multiple vitamins and minerals, and they are increasing the usage of calcium supplements with vitamin D.
Researchers say calcium and vitamin deficiencies are common among older adults. They targeted meal sites such as this one because seniors who come here are often less educated than they should be about healthy diets.
They tend to be a more frail and more low-income older adult audience, and they don't tend to have the wherewithal to get to the physician's office as often as they should.
Apparently the program is working, especially for those in greatest need of change. 19% of older adults who did not use calcium supplements before starting the Partners in Wellness program began taking them often or almost always after the program. Only 7% of people in a comparison group that did not undergo the program made these changes.
This program is highly successful. We're very fortunate that we've had excellent people deliver the program. We've had excellent materials that we've delivered, and so we're seeing changes in seniors' lives all the time.
Including seniors like Adja Terry and Grafton Creekmore. Both say they've increased their vitamin use since learning more about dietary supplements.
It helps you in every way because there's so many vitamins in there to help your body to keep strong and to supplement the food that you're eating.
The vitamins, as far as I know, since I've been taking them and all, I hadn't had the colds that seemed like I used to have, and things of that nature.
Those who worked on the study find the results modest, but encouraging.
It's very rewarding to me to reach out and help other people improve the quality of their life.
Well, thank you very much. It was a good group today.
Researchers believe the Partners in Wellness program will help older adults become savvier about supplements and therefore take charge of their own health.
Joining us in the studio to discuss the Partners in Wellness program and the importance of proper nutrition in the senior population is Dr. Nadine Arasahyun, an elder nutritional expert and registered dietitian with the University of Maryland at College Park. Dr. Sahyun has conducted a great deal of research focusing on assessing the nutritional status of older adults to determine the relationship between nutritional risk factors and the health status of this population. Welcome.
Thank you.
Why is nutrition and proper nutrition so important later in life?
Well, at any stage of life, nutrition is very important, and in old age it's just as important because it prevents chronic disease. It could also prevent the onset of disabilities. So it's really important to be aware of proper nutrition at that point.
I know it's a big issue that later in life older adults seem to lose interest in food. Why do you think that is?
You know, I think that nutrition and diet is at the core of our lives, and so there are so many different influences that can affect that. And one of the areas is that when we eat with our senses, the sight, smell, and the variety of food. And it's possible that with age we sort of have to change the way we eat because of problems with dental, with our teeth, oral health.
No, but I'm sorry, go ahead, because that's very important. Our dental, our health, go ahead.
Yeah, so there are some physiological changes that result in our changing the way we eat, and we adapt to those changes. And so we might have to change what we eat. We might not be able to eat the things that we've always eaten that we like, so the colors and the sight. So this is one area. Another could be that medication that we take could decrease our appetite. So there are a lot of contributing effects that could lead to losing some interest in eating.
Now, can poor eating actually lead to chronic conditions?
That's definitely, yes. Poor nutrition has been shown to result in chronic disease such as diabetes, hypertension, and several other risk factors and chronic diseases. So that's why it's so important to maintain a balanced, adequate diet, yes.
Is it a big problem among seniors, poor nutrition?
Well, you know, the older adults are a heterogeneous group of people, so there are some, on the whole, people tend to eat better, in fact, than people who are middle-aged because they're much more aware of their health. They try to make some changes so that they can adjust to the conditions. They want to live a healthy, older life. So, in fact, we're finding that people are eating better. But of course, there are segments of the population who, for one reason or another, it could be because of fixed income, it could be because of changes in social setting. All of these can contribute to leading to a poorer diet.
Now, if you enhance your diet and you get a better diet like we saw in the clip, what kind of diseases can that actually help by having better nutrition?
Well, by having better nutrition, it can prevent even disabilities, even if you have chronic disease. So you can control some, for example, diabetes.
I was going to say.
Right. Diabetes, if you have a good diet, then you can control all of the symptoms of diabetes. And the same thing with hypertension or even cardiovascular disease. If you're on a good diet, then you can prevent having a recurring problem. So all of these, so diet definitely helps with all of these chronic diseases.
Does it matter at what age you actually start eating right?
Well, you know, of course, it's much better to start eating right from the very beginning, at infancy. I mean, there are many studies that show the impact of infant nutrition with later onset of obesity, of cardiovascular disease and diabetes. But it's never too late to improve one's diet and to make changes. In fact, this is one thing I wanted to mention, is that even if you eat properly all your life, with age, there are some changes that happen. So even then, you have to make some changes. So proper nutrition and knowing what to eat is important at every stage.
At any age?
At any age.
We're going to come back in just a second. It's time for us to take a short break, but stay with us because we'll be back in a moment to continue our discussion about the Partners in Wellness program and the importance of good nutrition throughout your life.
True or false? Is it possible to lose the ability to produce stomach acid? It's true. An estimated 30% of seniors lose their ability to make stomach acid.
Hello again. Let's get back to our discussion about the Partners in Wellness program and nutrition issues with Dr. Nadine Sahyun, an elder nutrition expert with the University of Maryland at College Park. Welcome back. Okay. Tell me a little bit about food labels and why it's so important to read them.
Food labels are an educational tool, really, and a way to be able to learn what's in the food so that you can see whether that food fits in your daily life. For example, if you have diabetes and you want to know if a food has sugar in it or other ingredients that you don't want to include in your diet, then a label is a really good way of finding out what's in it.
Now, I know that in particular for mature adults, looking for fiber content and cholesterol content is important. Why is that?
Well, fiber is one of those ingredients that are extremely important in the diet. And in fact, the dietary guidelines have recommended to include fiber and made some recommendation how much to eat in fibers. So it's very important to look at the label and to look for those kinds of ingredients, exactly as you mentioned. And so fiber is one of them.
And I know that fluid intake is very critical. Why is that?
Fluid helps maintain the body and keep us healthy and keeps everything going, and dehydration can lead to some problems. So it's important for older adults to make sure that they're always having enough fluid. As we get older, we might lose the ability to feel thirst, and so it's always important to include water, liquids in our daily diet.
I know that your taste buds decrease exponentially, but you also lose the ability to feel thirst?
You can lose the ability to feel thirst.
That's fascinating.
That's one of the...
What about vitamin intake? Is it important to increase your vitamin intake as you get older?
Some vitamins are important to have more than for younger adults. For example, as in the segment it was mentioned that calcium and vitamin D are important in larger doses than for younger adults. And that's because we need the calcium so that we prevent loss of calcium from our bones, that we don't develop osteoporosis or brittle bones. So calcium, vitamin D. Another vitamins that is very important to have from products that are enriched with it is vitamin B12. Vitamin B12 is also a vitamin that maybe about 30% of the population may not be able to absorb very well. And so one of the recommendations is to include foods that contain vitamin B12 as enriched product. For example, cereals will have vitamin B12 added to them.
What about vitamin C in citrus products?
Vitamin C, well, fruits and vegetables are extremely important.
Oh, we heard that our whole lives, didn't we?
Exactly, yeah. And now we're showing that it is truly very important to include at all ages. And so we recommend about 5 to 7 servings of fruits and vegetables per day, so as much as possible to include in the diet.
A lot of our viewers are mature adults themselves, maybe in their 80s or 90s, but then their caregivers could be our viewers as well. How does a caregiver, what are some of the warning signs that your parent or an elder that you're taking care of may not be eating correctly?
Yes, in fact, there are some screening tools that are out there for caregivers exactly to be aware of some of those things. One of them, for example, is to see if how the person is eating and to be aware that the refrigerator has food in it, that the person is able to cook and prepare their own meals. We have a study, in fact, looking at this information for people who are leaving hospitals and going into their homes, and they're unable to cook and prepare meals. So it's important for the caregiver to be aware of that environment for the older adults and whether they can cook and prepare their meals. So that's one of them. Another aspect is to look at the intake of medications, because medication can decrease appetite and can have other side effects. So it's important to be aware so that the doctor of the older patient can actually be aware of the different medication that are being taken.
Clearly weight loss is a big issue, right?
That's absolutely, especially involuntary weight loss or weight loss it's crucial to keep track of that, because that's a sign of underlying problems. So yes, weight loss, let's see, problems with chewing and swallowing, so oral health is very important. One other area that touches a little bit on what you showed earlier is that if people eat most of the time alone, that can have an effect on appetite.
Interesting. What if you notice that someone you're caring for, if you yourself realize you don't have great eating habits, how do you improve on those healthy eating habits?
I think is to recommend to do a little bit of more social interaction with other people. If it's possible to come for a caregiver to come and have a meal with the parent, that would be really wonderful. Or to be able to get them to join maybe a congregate meal site, because the elderly nutrition program is so important for social interaction. And Also, and other areas would be to maybe suggest that one doesn't have to have a bland diet in order to...
More variety.
Yes, variety is extremely important. Variety, balanced meals are extremely important. And some
so
people,
not just one big cheesecake?
No, definitely not, yes.
So go ahead with variety. Sorry.
So variety is really important to add a lot of foods that could be interesting to people. I mean, just because you have to cut down on salt or sugar, that doesn't mean that there aren't some really exciting and good foods out there that could be fun to eat and enjoyable and add color and texture to the food. So I think bringing in some different ideas of what a person can add to their diet could be really great.
One of the things that I found so annoying was when airlines took away low-sodium foods or low, fat foods. It's very difficult for you to be able to order those on airlines. What are some of the challenges that you've encountered throughout your practice? In terms of nutrition and people being underweight or overweight, some of the people that you've actually counseled.
Right. Well, people are so different and they have so many different issues, and so one has to take individuals and see how that we can incorporate a balanced, varied diet in people's lives. And so it's important to understand people's backgrounds and their interests and their interest in food, the kinds of food that they normally eat, so that we can make those kinds of recommendations to their diets. There are a lot of things out there. There are spices and herbs and different things one can experiment with.
Yeah, and I was talking about the airlines because transitioning, into a healthy diet from an unhealthy diet must be difficult, and not being able to get access to it. What are some of the solutions that you can tell our audience about of how to get access to healthy eating?
It is difficult to change, but sometimes people think that they have to change everything so that they can have a healthy diet, when in fact it is really a gradual process. It is, for example, instead of going and buying white bread, why not try and get a whole grain bread? And whole grain, as we know, is so important. For example, instead of buying a food that has trans fats or high saturated fats, why not take a label, look at the label, as you mentioned earlier, and see how we can get foods about the same, but that has less saturated fat, no trans fat in it. So there are small steps that one can do on a regular basis, and then once we get used to one food, then you can try something else.
And isn't it 19 days and it becomes a habit anyway? So that's great. Thank you very much for being here.
You're welcome. Thank you.